Hi everyone, welcome back to my channel. So today I wanted to talk about a couple of YouTube videos that I found talking about long COVID and kind of the bigger implications of what long COVID is going to mean for those of us that have other issues. For example, Lyme disease, post-Lyme, what is now referred to as like post-Lyme disease syndrome, um, and ME/CFS, things like that. It's really interesting because there isn't a lot. It's not being talked about out loud, and I think there is a reason for that. The same reason that ME/CFS has been sort of buried, and post Lyme has been also kind of buried, is because it's not, people just want to say, okay, the pandemic is over, people got their vaccines, everybody, or they got the infection, they got over it, and they're fine. And there are some people, some researchers that are, that are looking into these conditions, for example, long COVID, because they know that it's going to become the next pandemic. So the two videos, there is a channel on YouTube called Knowable Magazine, and there were two videos. One is called Long COVID, A Parallel Pandemic. That one's about 20 minutes long. So what I really like about these videos is that they're not very long, but they're concise and they explain things very, very well and in a very organized manner. So if you do have, a chronic condition, if you have brain fog or any issues, issues that they actually talk about in these videos are actually ideal because they're shorter, they're concise, they're clear, and they're not going to require a ton of your attention span to watch. The other one, also on the same channel, is called COVID in the Brain, a Neurological Health Crisis. And I felt like they both really went well together. I would recommend watching Long COVID first and then COVID in the Brain second. It just feels kind of like an extra added piece to the first one. So basically, I'm not going to, give the whole rundown. I recommend that you watch these yourself. But what they're talking about is long COVID and the symptoms related to it, and what's going to happen now. And they do mention in the video that nobody's really talking about it, nobody's really saying anything. And some of these researchers are kind of like, why isn't anything being, why isn't this being talked about? Because it's going to become a massive problem. I think they said there was going to be about 1.2 million more disabled people. I mean, obviously that number is going to continue to grow, but in this, and I actually didn't even see what date it came out, but they said at that point there was about they were estimating about 1.2 million more disabled people. So a lot of businesses, workplaces, anywhere basically is going to have to start taking that into consideration, because we're going to have a lot more disabled people that need accommodations. And it's gonna get, and I've been saying this, you guys, if you've been watching my exosomes playlist, one of the reasons why I decided to move forward with the exosomes this year is because I know a lot of people are going to have long COVID, and they're going to be looking for solutions. And they're going to be desperate to find something to help them. And, I think stem cells and exosomes are going to be one of those things. I'm not saying that they do work for that. We really don't even know. I have had questions on my exosomes videos whether I think that they would help for long COVID, but all I can do is give my own experience, with that. But I have mentioned it, that part of the reason why I'm doing those videos is so that people in the future that are looking into exosomes or stem cells can refer to something, because I had nothing to refer to. I had very, very little to refer to before I went in, to do the treatment. And I have a feeling, even though I'm making the videos now and they're not getting a ton of views, I do foresee that in the future, in the very near future, people are going to be Googling and looking for videos on YouTube, looking for whatever information they can on these type of regenerative therapies, especially when they've exhausted all the other options. And some of these videos, this video, the first one actually talks about some of the options for treatment, which I thought was really interesting. One of the cool, well, not cool things, but one of the things that really stood out to me with the long COVID video was the plethora of symptoms that you can have. It is very much like post Lyme disease syndrome, or I think it's called post treatment Lyme disease syndrome. It's, a multi-system disease. It affects every system, or it can affect every system of your body. For example, your nervous system, fatigue, brain fog, your digestive system, digestive issues. They even compared some of the neurological symptoms to chemo brain. So it's even similar to people that have had chemotherapy and have that sort of fogginess that lingers after. So much like Lyme disease, it's a multi-system disease, and there is a spectrum. So, there was one guy that said that he just had like tingling in his feet, like he had stuck his feet into like a bucket of water with Alka-Seltzer. So not super painful, but just this constant little weird effervescent sensation in his feet. And then, of course, there are people on the other end of the spectrum that are bedridden, that have muscle spasms, that have just, lots of digestive problems, daily nausea, things like that. So there is a spectrum. As a matter of fact, I think yesterday my sister was here, and, my sister, so far, my sister, my dad, and my brother right now are, my brother's currently down with COVID. My sister had COVID earlier this year, and one of the symptoms when she had COVID was like a migraine. And she says ever since she had COVID, she's gotten that same type of migraine already a couple times post, after she got over the infection. So that can also be considered a form of long COVID. Obviously, it's not as debilitating as, the severe end, but that can still be considered as long COVID. And so that's also another thing to watch out for. The other thing that they do mention, which we are, starting to see now, is that you don't actually have to have a severe, like you don't have to have been hospitalized with COVID in order to develop long COVID. And so that's kind of one of the other things that scientists are kind of exploring as to why, like who is developing long COVID, because it's not necessarily people that have been hospitalized or on a ventilator or anything like that. The other thing too, which is the other study that has actually, it's actually been out for a while, and I've talked about this, I think, in another video, is that vaccination doesn't necessarily reduce your risk of long COVID. I think it's like very little. It reduces the risk very little. So that's kind of another thing to consider. And so some of these scientists and doctors that were in this documentary were talking about how they were concerned that mitigation measures, for example, masking, social distancing, those the kind of the mandatory regulation was lifted, and they kind of said, like, I don't think that people should get too comfortable yet, especially if COVID is still going around. People should still be trying to mitigate getting the infection entirely, even if you are vaccinated. So I thought that that was very interesting. I still continue to wear an N95 mask in public places. I don't mask up though among family. Like we just had people over for Christmas. I think my parents are actually going to bring my brother's kids here today as well. And I haven't been masking up around family inside, at home. But if I go to the post office or a store or even out to the swap meet, I'm still using an N95 mask. So I think one of the biggest takeaways for me watching these is that I think this is going to open the door not just to treatment of long COVID, but treatment of all the other conditions I mentioned, ME/CFS, post-treatment Lyme disease syndrome, that kind of thing, even maybe some autoimmune disorders. They did mention multiple hypotheses as to why these infections, these acute infections become, long. And I'm not going to go into detail, but one of them was persistent viral infection, autoimmunity, gut dysbiosis, and as well as viral reactivation and tissue damage. Tissue damage is the one that is most associated with hospitalization. So if you were hospitalized, if you had to be put on a ventilator, that kind of thing, you're most likely to suffer permanent tissue damage. And that one is the one that is probably not fixable or is only fixable to a certain extent. So there is kind of a long COVID that will not be that cannot be recuperated. And the good thing is that the other ones, there are already, for autoimmune illness, they can use already existing treatments for autoimmune illnesses like steroids and things like that. But that one type, the tissue damage, people that have been hospitalized and that had really serious issues, they may not bounce back the way that they were before. They do talk about potential treatments, which I just mentioned, like antivirals, steroids, things like that. But like I said, they really, they didn't stress it. I felt like the doctor was almost kind of like, well, because you can't really, here in the United States, we're not, even here in California, where masking was, mandatory for such a long time, it no longer is. It hasn't been mandatory in a while. And everywhere you go, people are not wearing masks anymore. So I think the doctor in the documentary was very cautious. She was just like, I don't feel, secure enough to stop wearing a mask. And, I wouldn't tell my kids not to wear a mask at school and things like that. She wasn't saying, I think a lot of these doctors are treading lightly because they don't want to, because these are government and state regulations. And if the government and the state is saying, there's the CDC told us it's okay to lift these things, doctors don't want to go against what the CDC is saying. But she basically did say, I wouldn't feel too comfortable not taking precautions still. So I found it very informative, very concise. One of the things that I do wish that they would cover, or that they would have covered, I guess because they were just, they were talking about the general population. Essentially, they're talking about, just everyday people, not specifically people with pre-existing conditions. They did not talk about risk factors. We all know the risk factors, right? Diabetes, being overweight, being over the age of like 65, stuff like that. But what I do wish that they would have talked about, or maybe even do a separate video on, is the people who are, I want to say people who are at higher risk, which I just ran down that list, but specifically people who already have medical issues. And almost sort of maybe examine, because there really aren't any studies. Obviously, I know that doctors and researchers are limited in what kinds of studies they can conduct, but it would be interesting to see, how it's affecting people with MS or other autoimmune illnesses, how it's affecting people. We know how it affects people with diabetes. How does it affect people with, HIV, things like that? Obviously, that, can be fatal, but it would be interesting to see if there are people with certain types of medical conditions other than diabetes that are at a higher risk, or how it's affected them. I know I did have one of my doctors tell me that a lupus patient, she was called into the hospital for a lupus patient. I think it was for a lupus patient. And he had, I think, not gotten the vaccine. And he had, I guess, a milder type of lupus prior to getting COVID. And then after he got COVID, he really regretted not getting the vaccine because his symptoms just really took off. Whereas before COVID, his symptoms were manageable. And so, it would be interesting to see whether some of these people develop worse cases. I do believe that I had COVID last year. I do have antibodies to COVID. If what I had last year was COVID, because I didn't test positive, it actually wasn't that bad. It was, I did have, it was like a flu. I had fever, chills, really crazy runny nose, that kind of thing. Um, but I did read as well that people who have like allergies, or, they have a lot of sensitivities to stuff, that they're not like as likely to get COVID or something. I can't remember what article I read that said that people that have allergies, or food sensitivities and things like that, for whatever reason, are not contracting it as much. Um, and I know that I've had, my doctor and another a researcher have both told me, because I said I never get sick. I never get sick with anything. I never get flus or colds or anything like that. And they told me, well, yeah, because your immune system is in overdrive. So I'm wondering if, in cases like us, where we already have a form of long something or other, whether it's Lyme disease, whether it's ME/CFS, whether this virus will bypass us because our immune system is already out of whack, or if it will compound on the issue and make it worse for us. Because that's kind of like what my conventional doctors have been telling me, is that, you need to be careful because you already have a pre-existing condition. Granted, it's an autoimmune illness, but what if it is just a version of post-treatment Lyme disease, which is like a long Lyme, long COVID type of situation, which maybe could be the reason why I never got really, really sick last year. I just kind of had a standard flu. And I never, like I said, I never get flus, never get colds. I'm always sick because I have this chronic condition, but I never get, those types of viral, bronchitis types of things. It's bizarre given that I'm always sick. So it kind of, that theory of having an overactive immune system, or an immune system that just isn't hitting the target, it kind of would make sense because it's focused on something else and seems to be bypassing everything else. And if you get something, and your immune system doesn't hit it, your immune system is what causes all of those symptoms. So I'm wondering if we're just like continuing to accumulate things without our immune system really hitting it. That's why we're not developing symptoms. I don't know. It's very complex, and I wish there was a doctor that could address that. Because, like I said, I've had my doctor and another researcher tell me the same thing, but not really explain what that means to have my immune system in overdrive. But I highly recommend both of these little kind of like mini documentaries, or, I guess like kind of news report type of videos, because you actually have a doctor, real doctors talking. The one of COVID in the brain was really interesting as well. It was much shorter. It was less than 10 minutes long, and it's a neurologist talking about how she's starting to see, COVID patients, long COVID patients with neurological issues, and how a lot of it is similar to, chemo brain, which is what she commonly treats in her practice. She's a neuro oncologist. So, a lot of these specialties are going to start to overlap. They're going to start to, pull people from different specialties to start exploring all of the symptoms that are developing because of long COVID. And it was very interesting to kind of hear her perspective as a neuro-oncologist. So I highly recommend them if you have a little bit of time, if you are, feeling well enough to watch them. They were very good and very interesting. And I know there are people that watch my channel that are struggling with long COVID. And that is why I have been making videos as well, because I want to make sure that, like I said, I know that this pandemic is coming. We're getting over one pandemic, and we're going to have another one coming very soon. And I know people are going to be looking for something. They're going to be looking for some type of treatment. And she does talk about how some people have become very, very desperate. And they feel very hopeless. And so even though, like I said, things have been a struggle for me this year as far as the exosomes have gone, at least you can make an informed decision by watching my videos. And there are differences, you know, between myself and somebody that has long COVID, particularly the length of time that you've been sick. But, you know, when I was looking into exosomes or, you know, some kind of regenerative treatment to help my symptoms, there's nothing, especially when it comes to exosomes. There's a little bit more information about stem cells when it comes to like Lyme disease and in, you know, autoimmune illnesses, stroke, things like that. But exosomes are kind of a new frontier, and that's why I felt like making those videos and making as many as possible would be helpful, because I wish that I was able to find other people that have done exosomes, and there really aren't that many. It's just it's a really complicated, you know, it's a tough choice to make when it's a new frontier, when it's a new type of treatment, and when there are very, very few people out there with the same condition that you have that have actually done a treatment like that. So yeah, I like all these resources. I love watching videos, informative stuff. I feel like you can't have too much information. So I highly recommend watching those videos. If you haven't seen my exosomes playlist, check that out as well. It's kind of long because I've been doing monthly updates. But you can just skim through it and see, you know, which ones you want to take a look at. But anyways, thank you so much for joining me. Please like and subscribe, and I will see